Kareem, your physical exam is normal in general. Today, we discussed a bit about your use of hash. We've started to explore pros and cons. Can you summarize them?
As I said, it helps me calm down, and I like it when I'm listening to my music.
Okay, do you see any negative aspects of it?
It's not helping my relationship to my father, and I get a bit suspicious when I smoke a lot.
Do you think it's affecting your school?
Not really. I mean, maybe at first, but even if I stop now, I can't catch up.
You're able to see that there are some positive aspects and some negative aspects to it. I would like to add that from what I've heard from you today, I feel like you're smoking more than you wish to, and that you try to limit your use, but you don't succeed at it. Do you agree?
I guess so.
Tell me, what are your thoughts about this?
I don't know. I have to think about it.
Fair enough. Why don't you do that and we can talk more next week?
Okay.
Great. I'll put an appointment for you next week. Would you like your father to come in so you could share with him what we decided and maybe see if he has any questions?
Yeah, okay.
Interventions for people with harmful or hazardous drug use. Engage the person in a conversation about benefits and harms. Challenge misconceptions. Avoid arguing. Assess the impact of the drug use on the person's life. State clearly the recommendation to cut down or stop harmful use and your willingness to help. Encourage people to decide themselves if they need to change. If people are not ready to stop or reduce use, encourage them to come back to discuss further, perhaps with a family member or friend.
Thank you for waiting, Mr. Talal. Kareem and I had a good discussion. Kareem, would you like to share with your father what we talked about?
We talked about hash and school.
So, are you going to stop the hash and going back to school?
Not for now.
You know this is bad for you. I don't know why you keep on doing it.
Mr. Talal, I understand your worries. Why don't you let Kareem talk a bit more about our discussion? Kareem?
We talked about the good sides and the bad sides of using hash. Maybe it's affecting me more than I think, but I like smoking it and I'm not ready to stop it. Dr. Mira thinks I have difficulties cutting down my cannabis use, and she asked me to think about it and to come and talk with her next week.
And the result?
I think I'll come.
You think you'll come? You're coming. I'm talking to you.
Mr. Talal, this is something that has been going on for many years. Things will take time to change. I see that Kareem is engaged in thinking and talking about his hash use. This is very important and this will help him take the decisions that are best for his future. I know this might take more time than you'd wish for, but it's important to support Kareem in this process. The family can be very important support, and we will talk more about how you can support him through. For the time being, let's give Kareem this week to think about our discussion, and then I'll continue this discussion with him next week.
Okay, doctor.
Kareem, do you have anything to say to your father or to me?
No.
I appreciate your openness to discuss this. I'll be waiting for you next week to continue our discussion, okay?
Okay.
Substance use in adolescence. Clarify confidentiality. Identify the most important underlying issues for the adolescent. Heads screen, home and environment, education and employment, activities, drugs, sexuality, suicide, and depression. Provide parents and the adolescent with information on the effects of substance use on individual health and social functioning. Encourage a change in the adolescent's environment, rather than focusing directly on the adolescent as being the problem. Encourage parents and/or responsible adults to know where the adolescent is, who they are with, what they are doing, when they will be home, and to expect the adolescent to be accountable for their activities. Encourage parents to set clear expectations, at the same time being prepared to negotiate these expectations with the adolescent and to discuss with adolescents the consequences of the adolescent's behaviors and nonconformity with expectations. Advise parents to limit their own behaviors which may be contributing to their children's substance abuse, including the purchasing or providing of substances or the provision of funds which are being spent on substance use, keeping in mind the potential influence of their own substance use on their children.